So, I'm just going to do a quick video blog about drugs, largely based around a book I'm reading at the moment called Bad Pharma by Ben Goldacre, who's a doctor in the UK. Now, I've been studying nutrition off my own back for about 8 years or so. It started as an interest in health and fitness, and it's gradually grown from that, and as part of that you learn a lot about pharmaceutical companies, drugs companies basically, because they have a lot of inroads with nutrition. It's not as simple as this is what you do. It's a lot more complicated than that, and they get involved because they can sell you stuff, special stuff you don't even need, and this is fine, and everyone thinks it's absolutely fine and dandy. And for reading this book, which I've just shown you, reading this book, I found something which I'm actually quite disturbed about, which I'm going to go through in a minute. But before I do that, I've got a few drugs leaflets here. These are leaflets you would expect to get in over-the-counter drugs that you can buy from any food store. Morrison's, we got ours from Morrison's, I imagine, and it goes through them as it goes on there. Now, I'm going to go through these quickly with you because I find these quite disturbing sometimes. I actually do find these quite interesting. When do then we'll actually read them. I don't imagine many people read them, but I'm going to start with aspirin. These are aspirin 300mg tablets. I don't suppose you can see that, but there we are. Aspirin 300mg tablets. Okay. Serious allergic reactions, asthma attacks, difficulty breathing, and skin reactions. It's not very clear on what skin reactions are. Does your skin fall off? Who knows? And other side effects, stomach problems and indigestion. We all have them from time to time, presumably. Well, I don't tend to, but you know. Bleeding from the stomach. Nice. Hearing disturbances, vertigo, mental confusion. My favourite one, because surely we all have that at some point every single day. And my favourite line of all, if you experience any of these or any other side effects and they get serious, contact your doctor or pharmacist. Any other side effects? Any? I mean, I know they're covering themselves, but come on. That's aspirin, which everybody probably takes or has taken at some point. Here we have Tesco's non-drowsy hay fever and allergy relief. Loratadine 10mg tablets. Okay, blah blah blah. Swelling of the face, lips, tongue or throat, difficulty in swallowing or breathing, a skin rash after taking the tablets. So, skin rashes seem quite common. I haven't actually read this before this video, so. Other possible side effects, headache, nervousness and tiredness in children aged 2 to 12. Headaches on an allergy tablet. Allergies quite often cause headaches. Interesting. Drowsiness, headache, increased appetite and difficulty sleeping in adults and children over 12. Again with the headaches. Very rare side effects are severe allergic reactions, difficulty in breathing, wheezing, itching, hives and swelling. Dizziness, rapid heartbeat, palpitations, feeling sick, dry mouth, upset stomach, changes in liver function. How would you know? Rash, hair loss and tiredness. Wow. It's worth noting that these tablets actually contain caffeine. So if you are feeling tired after taking these, I would be concerned. I'm going to be back in a minute. Sorry about that. I can't merge it into two films on the software. Well, I probably can, but I don't know how to. And I didn't want to make it into two videos. Okay, so the next one, paracetamol. Fairly common, pretty much sure that everybody will have taken paracetamol at some point. Possible side effects, skin rashes, or other signs of allergic reactions such as itching, swelling of the lips, tongue or throat, or difficulty in breathing. Fairly common. Well, fairly common side effects according to these drugs. Unexpected bruising or bleeding. Unexpected bleeding? Persistent tiredness. If you've got a headache, you may suffer tiredness. They're quite often connected. Or increase in the number of infections which you get. How long are you taking these things for? These are possible signs of changes in the blood. That's it. If you experience any side effects not listed, please tell your pharmacist or doctor. Any side effect? Fucking hell. Okay, and finally we have ibuprofen. Ibuprofen. Okay, there's actually a lot of side effects on this one. This is actually very long. Allergic reactions, skin rashes. They may be severe and include swelling and peeling and blistering of the face, mouth and genitals. Really? Sorry. Itching, hives, swelling of the face, neck or throat, worsening of asthma, difficulty in breathing, increased heart rate and low blood pressure. Severe allergic reactions occur very rarely. That's reassuring, isn't it? They don't say what very rarely is. Okay, very rare, 1 in 10,000. How many people take ibuprofen? The answer is lots. So it might be very rare, but if you're that 1 in 10,000, it probably doesn't help. If you're sick and it contains blood or dark particles of the right coffee grounds. Nice. If you pass blood in your stools or pass black tarry stools. You have a stiff neck, headache. These are headache fucking tablets. You are pissing fucking kidding me, you shitheads. Feeling sick, nausea, in case you don't know what that is. Being sick, vomiting, in case you know what that is. Fever and disorientation, which means apparently not knowing where you are, in case you didn't know that. I'm pretty sure if you can read this, you know what that means. These may be signs of aseptic meningitis. Wow. And if you suffer indigestion or heartburn, abdominal pain, or other abnormal stomach symptoms, what is an abnormal stomach symptom? Whatever. Blood disorders, again, how would you know? Now, they go through a list of these things and how, but apparently, fairly uncommon, 1 to 10 users in 1,000 people would get headaches from taking ibuprofen. They're a headache tablet. People often take them for headaches. Seriously, this is a joke. In fact, the list on this is actually pretty excessive. Massively longer than the rest. Right, anyway. Back to the point of what I'm actually trying to say. Really is this. Drugs companies choose whether to tell you the side effects of their drugs. That's right. Those side effects listed there on those medications are what they have chosen to tell you out of the goodness in their hearts. Which leads you to wonder, what are the side effects they are not choosing to tell you? That's actually quite disturbing. But it is quite clear in the early chapters of said book that it is optional for them to tell you side effects. They don't have to do it. And the reason why they typically do it, I imagine, is because it gets well known very quickly the negative side effects of drugs. Because of the internet, largely now, I imagine. But people have been documenting these things, and they've been keeping track of it, and they go onto forums, and they exchange this information, and you quickly find out that, hey, you know what? This drug has side effects that are not listed anywhere on there, and eventually, over time, they get listed on there. It seems really wrong to me that companies can choose to not tell you what the side effects of a drug. It actually seems really wrong to me that headache tablets could have headache as a side effect. But that's not actually that unusual, because statins, which are a cholesterol-lowering drug, are often linked to increased rates of heart disease, which is funny. If your theory is that cholesterol causes heart disease, anything that lowers cholesterol should not increase the rate of heart disease. But it does. And I'm going to leave that video there, because I have another one to do in a minute, which is going to be a little bit more animated, possibly. So thanks for watching, and read the leaflets in your drugs, see what they've got in them. But bear in mind, they always all have the caveat: if you have any other symptoms, talk to your pharmacist or doctor. Any other symptoms. I'm sure I can make a large number of jokes here, but I can't think of them right now. And that'll do.